Diagnosing histoplasmosis involves several steps. Doctors consider your symptoms, which can range from mild to severe. Common symptoms include fever, cough, and fatigue. In some cases, patients may experience chest pain, joint pain, or a rash. It's important to provide your doctor with a detailed account of your symptoms, including when they started and how they've progressed. They'll ask about your medical history. This includes any previous illnesses, travel history, and potential exposure to environments where the fungus is common, such as caves, bird roosts, or construction sites. Your occupation and hobbies can also provide clues, especially if they involve activities that disturb soil or bird droppings. They'll also perform a physical exam. This helps them identify any physical signs of the infection, such as swollen lymph nodes or a rash. The physical exam is a crucial step in narrowing down the possible causes of your symptoms. Lab tests are crucial in confirming the diagnosis. They check for the fungus in your body. This can be done through various types of lab tests. One common method is to test your urine or blood for fungal antigens. These antigens are substances that the fungus releases, and their presence in your body can indicate an infection. One way is to test your urine or blood for fungal antigens. These tests are often quick and can provide results within a few days. However, they may not always be definitive, especially in cases of mild or early infection. These are substances that trigger an immune response. Your body's immune system reacts to these antigens by producing antibodies. Detecting these antibodies can help confirm the presence of the fungus. Doctors may also take a culture. This involves taking a sample of your sputum, blood, or tissue. The sample is then placed in a special environment that encourages the fungus to grow. This involves taking a sample of your sputum, blood, or tissue. Cultures can be very accurate, but they take longer to produce results, often several weeks. This method is particularly useful for identifying the specific type of fungus causing the infection. They then see if the fungus grows in the lab. If it does, this confirms the diagnosis. The growth pattern and characteristics of the fungus can also provide information about its specific strain, which can be important for treatment. Other tests look for antibodies in your blood. These antibodies are proteins your body makes to fight the infection. The presence of specific antibodies can indicate a current or past infection. These are proteins your body makes to fight the infection. Antibody tests can be particularly useful in cases where other tests are inconclusive. They can also help determine if you've had a previous infection that has since resolved. If the initial tests are unclear, you may need more. A specialist can help. This could be an infectious disease doctor or a lung doctor. They have the expertise to interpret complex test results and recommend further testing or treatment options. This could be an infectious disease doctor or a lung doctor. They can provide a more detailed evaluation and guide you through the next steps in managing your condition. Early and accurate diagnosis is key to effective treatment and recovery.